Thanks, Dr. Pierce. Hello, everyone. Today, I will present a study examining the association of state Medicaid income eligibility limits and long-term survival after cancer diagnosis in the U.S. And next slide, please. The Medicaid program provides health insurance coverage to low-income individuals and families in the U.S. Estimated about 28 million non-elderly adults were enrolled in Medicaid at some point during 2019. And income eligibility limits for Medicaid vary substantially by state for the non-elderly population. For example, the federal poverty line for a family of four in 2009 was only about $22,000. And in Texas, the Medicaid income eligibility limits was only 27% of the federal poverty line. In New York, it was 150%. However, so far, little has been known about the effects of state Medicaid income eligibility limits on cancer outcome. So in this study, we aim to examine the associations between state Medicaid income eligibility limits and long-term survival among newly diagnosed cancer patients. And next slide, please. We use data from the National Cancer Database, which is a nationwide hospital-based cancer registry data that covering about 70% of all newly diagnosed cancer patients in the US. About 1.5 million adults aged 18 to 64 years, newly diagnosed with 17 common cancers between 2010 to 2013 were included in this study. And they were followed up through December the 31st, 2017 for up to 8 years of follow-up. And state Medicaid income eligibility limits were grouped into less than or equal to 50%, 51 to 137%, and 138% or greater of the federal poverty line. And we used multi-variable Cox proportional hazard models with age as time scale to examine the associations of eligibility limits and stage-specific survival, controlling for sex, race, ethnicity, metropolitan statistical area, number of health conditions other than cancer, year of diagnosis, facility type, and the random effect of state of residence. And next, please. Next slide, please. Yeah, thank you. And these two figures are the survival curves for all cancers combined for early and late stage cancer patients. The black line represents patients living in states with Medicaid income eligibility limits of 138% or greater of the federal poverty line. And the red and pink lines represents those living in states with limits of 51 to 137% and equal to 50% of the federal poverty line. And we found that patients living in states with lower Medicaid income eligibility limits had worse long-term survival within stage. And next slide, please. Similar findings were observed when stratifying the analysis by cancer site. For example, for female breast cancer, we found that lower Medicaid income eligibility limits were associated with worse long-term survival within stage. And from this multi-variable Cox proportional hazard model, we found that for early stage female breast cancer patients diagnosed between 2010 to 2013, the rate of death due to any causes were 31% higher in states with Medicaid income eligibility limits no greater than 50% of the federal poverty line, and 17% higher in states with limits between 51 to 130%, compared to similar patients in states with limits 138% or greater of the federal poverty line. And next, please. And similar findings were also observed for late-stage female breast cancer patients and some other common cancer sites, including prostate, colorectal, and non-small cell lung cancers. And these findings were also applied to most other selected common cancers, other cancers in this study. And next, please. In this study, we found that patients with cancer living in states with lower Medicaid income eligibility limits had worse long-term survival within stage across multiple cancer sites. And policies to increase Medicaid income eligibility limits, such as Medicaid expansion, may help improve survival following cancer diagnosis. And I want to thank all my co-authors and cancer registries and their staffs for their hard work. And thanks for your listening and looking forward to the discussion in a while. Thank you.